Good afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. We'd like to welcome you to our webinar on telemedicine, healthcare at your beck and call, presented in collaboration with Friends Health Connection. As many of you know, COVID-19 has changed many of the ways we interact due to social distancing and brought a greater reliance on technology to connect us with each other. Over the past few months, more and more healthcare providers have turned to telemedicine to care for patients. During today's webinar, we will get an overview of telemedicine, how it works, and its benefits from our special guest, Hershel Shaw, Digital Experience Manager for Robert Wood Johnson Barnabas Health. We will begin our webinar with about 20 minutes of a moderated discussion, and then we will open it up to questions from our audience. And at that time, please feel free to log on your questions in the chat box. So let's first begin, Harshal, with you telling everybody a little bit about yourself.
Sure. Well, as you mentioned, Serena, first of all, thank you for having me on this webinar. My name is Harshal Shah. I am the Digital Experience Manager over the system of RWJ Barnabas Health. I kind of oversee digital experience. So what does that mean? That means I take into account all the experiences from our providers, from our patients, and assist them in putting the best foot forward. So I also oversee a lot of telehealth for the system as well. My background is not really from telehealth itself or IT, it's more administration. So I did, when I went to Seton Hall University, graduated with a master's in healthcare administration, and then I went on to Drexel to complete my MBA. My experiences are from the patient experience side all the way to quality and care coordination. So I focused on meaningful use, I focused on all sorts of things. And telehealth is one of my niche that I started to focus on a few years ago, and that's when I got into it, establishing some of the underlying methodology around that with a lot of partners that I had. So that's just something about myself.
Well, thank you for sharing. That's very interesting. And it's always beneficial to learn about our speakers for the day. So, telemedicine, very broad topic. What is telemedicine? Why don't we start there?
Yeah, so telemedicine, 100% very broad topic. Let's move it back a little bit. So telehealth is a much broader topic. Telehealth encompasses telemedicine, encompasses remote patient monitoring, where a patient can go home with certain devices or peripherals. It encompasses telestroke, it encompasses provider consultations, even telehealth that is done to provide professional health related education, providing health administration. So telehealth itself is a larger, broader topic. Telemedicine sits under there, where it provides a virtual visit with a provider that may not be in the same location where the patient is. A lot of times, telehealth and telemedicine are used interchangeably. So it's very important to understand that telehealth is encompassing a larger, broader umbrella, while telehealth focuses on that visit with a provider when the provider is not available where the patient is.
Oh, great. All right. Well, thank you for that explanation. Now, I've heard, many people use telemedicine versus telehealth. So what is the difference between telemedicine and telehealth?
Yeah, so telehealth, you're going into remote patient monitoring, you're going into telestroke, you're going into tele-ICU. Those components are related to all telehealth. Telehealth we use as a broader conversation about establishing a strategy, and what encompasses within the strategy could be something like telemedicine that sits under it. Providing telehealth and telemedicine, we talked about origination sites and distance sites, where we figure out where the patient is sitting and where the provider is sitting. And then there's also other types of telehealth that relate to asynchronous visits or synchronous visits. Synchronous visits are described more of a telemedicine. Telehealth can also accompany asynchronous visits, where it's a one-way conversation with a provider. So I can send a request to a provider or a questionnaire to a provider, and the provider has a certain time frame to return my response.
Okay, very good. Thank you. So what are some of the ways in which Robert Wood Johnson Barnabas Health is using telemedicine services?
Yeah, so our system is all hands in with telehealth. I mean, we use it for primary care visits. We use it for oncology visits. We use it for pre and post transplant visits. We currently have telestroke programs. We have telebehavioral health programs. At some areas, we also have telepeds programs. I know our children's specialized hospitals are using a lot of telehealth. Our rehab areas from our system are going to also be starting to use telehealth. It's especially important during the crisis of COVID-19. It's really the primary way of communication and providing patients that support and the care they require during all these times. Eventually, it's kind of coming along with the fact that our system is very adopting all this various technologies and learning from it so we can provide better care to all of our patients.
Wonderful. Thank you so much for that broad explanation. So what are maybe some of the doctors or specialists, I know you mentioned a few, that are presently using telemedicine? Is it just primary care, or is it broader than that?
Nope. Our medical group is using it today, starting off primary care. Our specialized areas such as oncologists for the system are using it at different areas of the system. Our pre and post transplant physicians are using some kind of level of telehealth. There is also speaking about learning from behavioral health consults, doing dermatology visits. I think some of those things are in pending mode, but we have multiple specialties using it today, kind of focusing on and learning from what they should be doing today.
But not all of them are using it, or
not all of them just yet. We're getting to that point though.
Okay, good. So is there any difference in the quality of care you receive between a virtual and an in-person visit?
So, this question is a great question because I always like to refer to the study that I read that stated that patients reported strong personal connections with providers using telehealth visits. That encompassed 62% of those patients said the quality of telehealth visits was just as good, if not better, than an in-person visit. When we think about what the quality is, we think about where the patient is going to be. Patients are often more relaxed and candid during a telehealth visit. They often don't miss work because the telehealth visit can't happen where the patient's located. Think about the process of going physically to see a physician. Driving, parking, waiting in the waiting room. So it kind of puts them in a better mood to actually have a telehealth visit. So, for our system, we take that as a very high priority. We provide, if as good, if not better, quality of telehealth visit as best we can.
Very good, thank you. So let's talk about the technology behind telemedicine. What is the technology? Is it this type of format? How user friendly is it? Can you access it from your phone, or is it like a Zoom or a GoTo? Can you speak to that?
Yes. So we are in changing times. I mean, there is a new technology almost every day that gets created. We have Zoom applications like Zoom. We have GoToMeeting. We have multiple sorts of vendors that provide the technology today. When we talk about what technology is really focused on telehealth, it could be simple things as a Bluetooth glucometer or a Bluetooth blood pressure cuff that can get connected to your phone or a tablet and sending that information to your own physician. That's a telehealth technology. We have other companies working on providing glucometers via your contact lens, and you can actually determine some of those things. We have a smart stethoscope that is used today to provide real-time results of potentially having, for kids, let's say if a patient or a parent is at home, they need to monitor their baby, a newborn, they can provide that with the stethoscope. They can provide real-time data to the provider directly. So it's that technology, and breaking it down into a virtual visit is how effective and efficient can that technology of video to video or a video and audio to a video and audio to a provider can be. So that's where telehealth and virtual visits come in. So the basis of every technology is that communication. can you establish a video and audio communication? You know, at the same level, you have to make sure that it's more of a secured and HIPAA compliant solution.
Okay. So, well, speaking of HIPAA, thank you for bringing that up. Let's talk about that. How secure is this technology, and does it protect your privacy?
It does. So our all our technology is all HIPAA compliant. We make sure we go through a very intense information security review. We make sure that it meets standards of our system as well as federal regulated standards as well.
Very good. So in your opinion, what are some of the benefits of telemedicine for patients? Let's start there.
Yeah. So, I kind of went into this a little bit. You're thinking about today versus sometime last year or in the near future. What everyone is working, everyone has a job, everyone is busy with their own lives. How do we make that more efficient for them? Using telehealth, patients save those travel times. They don't have to commute from one end to the other to see a provider. They don't have to, find parking. They don't have to go through all the hassles of actually seeing a provider. They can do that from home. Sometimes a lot of patients miss work because they are unable to see the doctor. Doctor may not be available at times the patient may be. So how do we effectively manage that? So it actually helps employers and businesses reduce time that employees that take for going to medical visits. And then it provides the alternate access to the provider. You can go see a physician in person anytime, depending on their availability. But let's say if you have something that you need to see the provider right away, you can actually manage to do that just by logging on to telehealth and communicating with the provider. There are other technologies that if your caregiver is not with you at the time, or if you want your spouse, maybe your kids to join in a telehealth visit, there are ways we can accomplish those things, joining a third party in that conversation. So everyone is aware of what's going on. Not just our system. I know other areas that have established some process in terms of, let's say, if a provider can, if your primary care provider says that you need to go see a specialist, you may not have to travel to go see the specialist. You can just come to the primary care provider's office and they can loop in via telehealth a specialist via video to have that conversation with you. So it's thinking more innovatively and how it can actually largely benefit a patient through all those means.
Sounds good. So then you talked a little bit about the benefits to the patient. What about the benefits to the healthcare provider?
Yeah. So I'm going to start with today. Today, we are made aware that we want to make sure our patients are safe as best we can. So we are switching our mode of communication to provide telehealth as best we can. So they don't have to come in for an in-person visit for a typical conversation that they need to have. Providers can actually improve time management with seeing patients on telehealth. They don't have to overbook. If a patient went over their time, they can still manage to see another patient. A lot of physicians have taken account into office visits, in-person visits, and combined them with telehealth. So you have gaps of telehealth and you have gaps of in-person, and it actually helps improve their time management to better manage their patients. They may be able to see more patients as well, because now a patient's not waiting too long. There's decreased time in intake because all that's done on telehealth. Increases productivity, as I alluded to, in terms of seeing more patients, more process implemented, expands the reach. So providers can see patients anywhere in New Jersey as long as you're licensed. So a patient from South Jersey, they're able to see. They don't have to worry about the patient coming in. They can just see them via telehealth. When you're traveling, let's say if I went to the shore this weekend, I can still see that patient from my location. And adding another provider, I'm going to go back to this every time because I think it's a great kind of use case. When I'm a PCP, if I need to loop in a specialist, that's the best way to do this. And the specialist can be located anywhere. The conversation, the communication increases as well for providers. Providers can actually see the whole patient story via telehealth equally as they would as in person, which is also always beneficial.
Fantastic. So, with a lot of people, working from home, how does this help businesses care for their employees?
Well, the businesses, we learn by trial and error. I mean, it's important that employees take care of themselves, and providing businesses provide that telehealth component to their employees, minimizes their time off work, keeps making sure their employees are safe and cared for, as well as their families. I think it's really important that we focusing on the employee as a whole. Telehealth can provide that whole. They can see all sorts of providers, as I mentioned, via telehealth. And with the changing of times, new regulations coming about, Medicare, Medicaid, commercial payers changing it, I think it's really important that we encompass using those tech technology to better care and provide that service to our patient.
Oh, great. So, of course, in an emergency situation, right, telemedicine is not appropriate. So let's remind our audience about what type of situations may require immediate care and a call to 911.
Yeah, so, chest pain, chest pressure, coughing, vomiting blood, difficult breathing, shortness of breath, severe abdominal pain, all those kinds of things. If you're in pain, definitely go to the hospital. If you have chest pain, definitely go to the hospital. We want to make sure you see a provider as soon as possible. Telemedicine is not to be used for medical emergencies.
Correct. So perhaps even a stroke too, right?
Yep.
Opening, drool of the face, numbness.
Yep.
Oh, great.
Go to the closest ED.
Sounds good. So while at this time, I want to make sure we give time to our audience to open it up for questions and answers. Again, a friendly reminder to put your questions in the chat box. We will then be able to ask our guest speaker those questions. While I'm giving everybody a little bit of an opportunity to put in questions, I wanted to just ask you a point that you had mentioned. You're seeing with the providers, it allows them at times to, see more patients. They can manage the patients, really well. Out of curiosity, have you seen any doctors actually expand their office hours as a result of telemedicine?
I have, because we are providing that services, and we are providing that capability of providers. They can you can see a patient anytime. Let's early, a lot of physicians have started working from home. A lot of physicians go to the office early to do an intake. Maybe their office opens at 9 o'clock, but they may be able to start seeing patients at 8 o'clock because they don't have to get everything ready just right away for an in-person as they would.
Oh, that's good. That's great. So it sounds like maybe they even have been opening up to evening hours.
Yeah. Yep.
That's awesome. All right. Fantastic.
It's definitely provider or practice based. If we start doing it, it's something that providers and their staff and the medical group and our staff at our hospitals have worked on. It's kind of creating that process. And what this whole process has taught us is that we have to make sure that we're in the forefront of the changes that are happening.
Sounds good. So we have a few questions that have been posted. Dare I ask, we're getting one about, does telemedicine, is it covered by insurances? Maybe if you could speak very broadly about that.
Yeah, so a lot of insurance companies have put into place certain reimbursement protocols for telehealth. The best approach I request is to contact your insurance company. They should have something in place for telehealth and telemedicine today.
Okay, very good. The next question is, okay, this is two-part. So the first is, how safe is it if we need to go to the hospital right now for things, for emergencies and things like that, and then for blood work and things like that? Can you speak to that?
I can't speak to it in detail, but I know the conversations I've had, it is safe to go to the hospital.
Yeah, I was just about to say, well, I definitely can speak to that. And I will definitely say that, the hospital is a very safe place to go to. In fact, we pre-screen everybody coming in through the doors and we make sure that they're masked, we take temperatures. So it is probably one of the safest places to go. And we are appropriately socially distancing. In fact, if you have visited at least our site, there are even signs that will say, please stay 6 feet away, to ensure the social distancing. So, in fact, if it is an emergent situation, please don't delay. Make sure you get to the hospital in that emergency room. Every precaution is being taken to ensure your safety and health, that of yourselves and of our team as well. So I got another question. For things we can't do through, oh, okay, that's part of the other one. Is telehealth 24 hours? But that's a very good question. How and when can you access telehealth?
So again, there's different components of telehealth. The best thing to do is if you're looking to see your own primary care physician or your own provider, definitely contact them to see if that's available. There are other, we do provide a 24/7 on-demand service through our partner today to provide that 24/7 support of telehealth. And we actually have a code that you can use today to establish, care, and I think it's only $15 today through the system. And that you would not see one of our providers, you would see someone else's providers. But that's just to ensure that we can provide care at a 24/7 basis. But if it's during business hours, if it's during that, I definitely recommend contacting our providers.
Very good. So, and just to clarify, this next question from one of the callers is, can we ask for our specific doctor through telehealth? So, again, this may go back to some, like, are the certain doctors participating and certain doctors aren't?
So if your physician is part of our system, my best recommendation is to contact your provider. They would probably have the most up-to-date information, and if they are able to, I think they would be able to accommodate you in telehealth.
Okay. So our next question is twofold. What is the biggest challenge when trying to implement a telehealth solution? So both from, and I guess maybe if you could maybe touch base on from the provider perspective as well as the user perspective. What do you think may be the biggest obstacle or challenge there? Sure.
I wouldn't consider any of these the obstacle. I think everything is in a process. If it's a net new program for telehealth, I think it's adoption and making sure that adoption increases as we go on. Not just provider adoption, patient adoption as well. I think because of COVID crisis happening right now, a lot of patients, a lot of providers have moved along that process of adoption and increased adoption. So I think it's really beneficial to show that.
Okay. So when selecting a telehealth platform, what do you focus on when selecting a vendor?
Yeah, the system has their own. We've provided some criteria in terms of which vendor that we want to go with. Our system is moving to a new EMR system-wide, and it's a few years of a process. But going into that EMR will provide some of the centralized approaches that we need to focus on. But when selecting a specific telehealth vendor, we want to make sure that they're secure, they're HIPAA compliant. They provide the services that we can accommodate, like video and audio services in a secure platform. The access for patients and the providers, maybe a mobile app, or ensuring like they can go to the website to address those conditions. So it's all through that, and we are in a area where we have a criteria.
Okay, thank you. So our next question is, again, how do we know it's confidential? And I think this goes back to the privacy, but what reassurance can we give the community that it is confidential?
Yeah, anything, because of our federal regulations, because of our, strict process for information security, we do take security very seriously, confidence very seriously, and privacy very seriously. So any of the platforms that RWJ Barnabas selects and works with are all secured platforms at all times. And if you have concerns about security, if you have a telehealth visit, I definitely want you to talk to your provider to make sure that they can make you feel comfortable before that visit. The other thing is that any of the platforms today that provide telehealth, they have to go through a HIPAA compliant process as well themselves before even coming to us.
Great, thank you so much for that explanation.
Yeah.
So, now we've seen a surge with, telemedicine because of COVID, but what, post-COVID, what role do you see telemedicine having, in the future?
I think telemedicine is going to be essentially a new service line. Depending on, we see a lot of commercial payers, Medicaid, Medicare, changing a lot of restrictions and providing temporary restrictions. They're going to work on providing that reimbursement model. I think telehealth is a excellent way for the future in this crisis. And I think, once we go post-crisis, there's always going to be that question, can we provide telehealth services to make a patient's or a provider's process easier?
Yeah, and do you foresee this potentially enhancing doctor practices in the sense they do in-person visits and
100%,
telemedicine?
100%.
Very good. Well, it's definitely a very interesting, new service that hopefully is providing additional access to care for individuals in a very unprecedented time for all of us, for sure. We have one additional question. So can we access all services through telehealth?
It's a loaded question. So you can access services through telehealth. What's the all encompass though? If it's available to you with your own primary care specialist, you can do that. If you were looking for routine blood work, that may not be possible via telehealth. That requires your in-person thing. But I think, the focus is that providing a digital healthcare delivery model is going to be very important. And learning through all this COVID responses, that's where we're going to get to. So, possibly in the near future.
So the next question, real quickly, is: are all service lines available? And I think you mentioned that presently no, but are there plans?
They're working on it. They're working on it to make sure that we can accommodate as best we can.
Very good. Well, thank you. So thank you so much. I want to be mindful of our time, and thank you again, Hershel, for being on today's webinar. This will actually conclude our webinar for today. I want to thank, on behalf of Robert Wood Johnson University Hospital, Somerset, all of you for joining us. For more information about telemedicine services offered by RWJ Barnabas Health, please visit www.rwjbh.org. Thanks again, everyone, and have a great day.